Rabies is a viral disease caused by the rabies virus, a member of the lyssavirus genus. It primarily affects mammals and is transmitted through the saliva of infected animals. Rabies is the deadliest disease in humans. Once symptoms appear, it's almost always fatal. While there is a vaccine to prevent rabies if administered soon after exposure, once symptoms develop, there is no cure. Death typically occurs within days to weeks. Rabies is one of the oldest known viral diseases, with records dating back over 4,000 years. One of the earliest known mentions of rabies dates back to around 2300 BC in the Eshuma Code of Babylon, an ancient legal code discovered in Mesopotamia. The code describes penalties for owners of dogs that bite individuals and transmit madness. Throughout history, various civilizations documented observations of rabies-like symptoms in animals and humans. Ancient Greek and Roman texts also contain references to rabies, describing the disease's characteristic symptoms such as aggression, foaming at the mouth, and fear of water, which are indicative of the neurological effects of the rabies virus. Rabies has a distinct mode of transmission. Rabies is primarily transmitted through the saliva of infected animals. The most common mode of transmission is through the bite of an infected animal. When an animal infected with the rabies virus bites another animal or a human, the virus contained in its saliva is introduced into the wound. The virus then travels along nerve fibers towards the central nervous system, ultimately leading to the development of rabies symptoms. Rabies transmission can also occur through other routes besides bites. For example, while less common than bites, rabies transmission can occur through scratches from infected animals. This can happen if the virus present in the saliva of the infected animal comes into contact with broken skin, such as through a scratch. Rabies can also be transmitted if infected saliva comes into contact with mucous membranes, such as those in the eyes, nose, or mouth. This can happen through activities like being licked by an infected animal, particularly if there are open wounds or mucous membranes exposed. In extremely rare cases, rabies transmission has occurred through organ transplantation from an infected donor to a recipient. This is an exceptionally rare mode of transmission but highlights the ability of the virus to spread through infected tissues. Natural reservoirs for the rabies virus are bats. Even though only a small percentage of bats carry the virus, they play a crucial role in the transmission cycle. Due to their ability to fly, bats can easily spread the virus over large distances, contributing to the complex ecology of rabies transmission. Rabies has one of the longest incubation periods of any infectious disease. The incubation period refers to the time that elapses between the initial exposure to the virus and the onset of symptoms. In general, the incubation period for rabies can range from a few days to several years, although the average is typically 1 to 3 months. However, there have been rare cases where the incubation period has been as short as a few days or as long as several years. During the incubation period, the virus begins to replicate and spread within the body, initially targeting muscle cells near the site of the bite. It then travels along nerves towards the central nervous system, where it ultimately causes the characteristic neurological symptoms of rabies. The variability in the incubation period is due to several factors. The closer the bite is to the brain or central nervous system, the shorter the incubation period is likely to be. Bites on the head and neck tend to have shorter incubation periods compared to bites on the limbs. The amount of virus transmitted during the bite can influence the speed at which the infection progresses. Larger amounts of virus can lead to a shorter incubation period. Individual variations in immune response can also affect the incubation period. A person with a robust immune system may be able to control the spread of the virus for a longer period, leading to a longer incubation period. Different strains of the rabies virus may have varying incubation periods. Rabies has one of the highest fatality rates of any infectious disease, with a mortality rate approaching 100% once symptoms appear. However, immediate and thorough post-exposure treatment with rabies vaccines can effectively prevent the onset of symptoms if administered soon after exposure. The symptoms of rabies typically progress through several stages, with each stage characterized by specific clinical manifestations. The prodromal stage, which lasts for 2 to 10 days, is characterized by nonspecific flu-like symptoms, including fever, headache, malaise, fatigue, and discomfort at the site of the bite or exposure. During this stage, the rabies virus replicates at the site of entry, usually a bite wound, and begins to spread along peripheral nerves towards the central nervous system. The initial viral replication at the site of entry and the immune response to the virus contribute to the flu-like symptoms. As the virus reaches the brain and the spinal cord, it targets neurons, causing inflammation and neuronal dysfunction. The acute neurological stage begins. Neurological symptoms result from the virus's direct effects on the brain and spinal cord. Symptoms include hyperactivity, agitation, anxiety, confusion, sensitivity to light, hallucinations, and fear of water, also known as hydrophobia. Hydrophobia is a classic symptom associated with rabies infection in humans. In the context of rabies, it's not a psychological fear of water, but rather a physical inability to swallow liquids due to severe spasms in the throat muscles. This symptom occurs as a result of the virus's effect on the central nervous system. When a person infected with rabies attempts to drink water or any liquid, the spasms in the throat muscles make it extremely painful and difficult to swallow. This difficulty in swallowing fluids is one of the hallmark signs of advanced rabies infection. In some cases, after an initial phase of excitability and hyperactivity, patients may transition to a paralytic stage due to progressive damage to the brain and the spinal cord, leading to motor neuron dysfunction and paralysis. The virus disrupts normal neurotransmission and interferes with muscle control, ultimately resulting in paralysis and coma. As the disease progresses, paralysis may spread to the muscles involved in breathing, leading to respiratory failure and death.